My name is Scott Langston, and this is one of a series of videos discussing particular mental health conditions, giving a little bit of information about what they are not, and how we typically would go about treating them and working with a client. So today I'm going to talk to you about depression. Depression is often spoken about quite casually. We use the word to describe something that's not depression, that is sadness, or lack of motivation or disappointment. We hear phrases like, oh, I'm depressed today when someone's had a bad day. We hear people giving advice to genuinely struggling people, like, just think positive, or there are people worse off than you. These comments are usually well intended, but they reflect a deeper misunderstanding of what depression is, and more importantly, perhaps, what it is not. So my goal today is to try to help to clarify that, what depression is, what it's not, and how different forms of therapy can help people to recover, to manage their symptoms, and rebuild their lives. So depression is a medical and psychological condition. It's not a personal weakness, and it's not a character flaw. Clinically, it's known as major depressive disorder, and it affects how a person thinks, feels, behaves, and even how their body functions. Depression is not just sadness, though sadness is involved. Sadness is a normal human emotion that comes and goes. Typically, it has a cause. You feel sad that your pet has died. You feel sad that a relationship has ended. Depression, on the other hand, is persistent. It can last weeks, months, longer. It interferes with your ability to live a daily life, a normal life. And often it's difficult to pinpoint a particular cause. So common symptoms of depression include a persistent low mood, or what is described as emptiness, a loss of interest or pleasure in activities which were once enjoyed, a general fatigue or lack of energy, difficulty in concentrating and in making decisions, and very often changes in sleep or in appetite. Other symptoms can include feelings of worthlessness or excessive guilt. They can include a sense of hopelessness about the future. In more severe cases, depression can involve thoughts of death, thoughts of suicide. Most importantly, depression is not caused by one thing. It's unlikely to be caused by one event. It develops from a combination of genetics and brain chemistry, which we don't fully understand. Trauma or long-term stresses, major life changes or losses, chronic illness or chronic pain, and social isolation and lack of support. Which means that somebody can have a good life on the outside and still experience depression on the inside. Success, money, relationships, and intelligence do not make somebody immune to depression. In order to understand depression, we need a very clear understanding of what it's not. Depression is not laziness. When someone with depression struggles to get out of bed, it's not because they don't care or because they're not trying. Depression affects motivation at a neurobiological level. Tasks that seem simple and obvious to others can feel overwhelming or just impossible. Depression is not something that you can snap out of. Telling someone to cheer up or look on the bright side is like telling someone with a broken leg to just walk it off. Thirdly, depression is not a sign of weakness. In fact, many people with depression are incredibly resilient. They go to work, they care for others, they function in their daily life while carrying an often invisible weight. Seeking help is not a failure, it's an act of strength. And finally, depression is not the same for everybody. Some people appear tearful and withdrawn. Others may seem irritable, high functioning, or emotionally numb. This is one reason depression often goes unnoted, undiagnosed, and untreated. Now we know what it is and what it is not, we can talk about how therapy can help. Therapy is not a magic pill. It doesn't erase pain. It doesn't fix people. What it does is it provides tools, understanding, and support. and it can help individuals navigate depression and to reduce its impact. There are several types of therapy commonly used to treat depression, and I'll go over some of the most well-researched and effective ones. If you follow the links to my website in the notes that go with this video, you'll see links to videos that I've done on each of these in more detail. So very briefly, cognitive behavioral therapy, CBT, is one of the most widely used treatments for depression, based on the idea that thoughts, feelings, and behaviors are interconnected, and depression can often lead people into negative thinking patterns and loops, such as assuming the worst, blaming themselves, or believing things will never improve. CBT helps people by identifying unhelpful and distorted thoughts and replacing them with more realistic and helpful thoughts. It's structured, it's practical, it's goal-orientated, and it can be a fairly short-term therapy. Psychodynamic therapy focuses more on emotional patterns and past experiences, particularly early relationships and unresolved conflicts. It digs deeper than CBT, and it helps individuals to understand why some emotions can feel overwhelming. It can help them understand how their past experiences form and shape their current relationships, and how unconscious patterns contribute towards depression. For some people, depression is linked to unresolved grief, trauma, deeply internalized beliefs they hold about themselves, and psychodynamic therapy offers a space to explore these issues and generate greater self-awareness. Acceptance and commitment therapy, or ACT, teaches people to relate to their thoughts and feelings in a different way. Instead of trying to eliminate negative thoughts, it helps individuals accept difficult emotions, but without judging them, reduce the struggle against these internal experiences, and clarify their personal values. ACT can be particularly helpful for people who feel stuck fighting their thoughts and who believe they must feel better in order to be able to live fully. It absolutely must be said that therapy on its own is not always enough. For others, therapy can work and be very, very effective. For a smaller number of people, therapy needs to be combined with medication. Antidepressant medication helps to regulate brain chemistry. It makes it easier for therapy to be effective. So medication is not a shortcut or a weakness. It's one tool amongst many. Think of somebody with a very damaged leg walking with a walking stick. The stick helps them to walk and move around and get on with their life, and helps them to get to physiotherapy so that they can have the exercises and the treatment that their leg needs to fully recover, and then hopefully cast the walking stick aside. The most important thing to understand about treating depression is that it's individualized. What works for one person is not necessarily going to work for another, and that's okay. Depression is treatable. People do recover from depression. They can rediscover joy, purpose, and connection in their lives. Recovery does not necessarily mean the absence of sadness, but it means learning how to live fully even when life is difficult. So if you're struggling, or you know someone who is, help is available. Listening without judgment and encouraging professional support and challenging stigma can literally save lives. Depression thrives in silence. Understanding and compassion are powerful forms of treatment in themselves. Reaching out to a professional is the first step in healing yourself if you are suffering from depression. Thank you for listening and for being part of a conversation that really matters.